Well, the NFL has released its schedule for the 2020 season. It'll start in September as usual, but there are, of course, contingency plans in place if the league needs to push back the season because of the coronavirus. This comes as many other sports leagues have already postponed their seasons amid the pandemic. One former NFL player has taken his talents from the field to treating coronavirus patients on the front lines. I want to bring in Dr. Myron Rolle. As I mentioned, he's a former NFL player and now a neurosurgery resident in Massachusetts General Hospital. Thank you very much, Myron, for joining us. You know, you've been working on the front lines by treating coronavirus patients. What kind of conditions have you seen?
Well, thank you for having me. I've seen a lot of devastation, certainly. I've seen patients having to have these goals of care discussions with their family members about their health and where they're going to go forward. Intubations having to be done emergently or urgently. Our hospital being transformed using different personnel, being repurposed in different parts of the hospital, redeployed to take care of a surge of patients that came in the Boston area. So it's been a very transformative experience at Mass General Hospital, but it's been all hands on deck with a team approach. And we're just trying to do the best we can to sort of manage how devastating this issue is, how many people it affects, and how novel it is that we just don't know so much about it that we can sort of get ahead of the curve of this pandemic.
I think that's the hardest part of this. There's just so much we don't know about this virus. Myron, I'm curious, how has your background on the football field helped with your transition into medicine and helping these coronavirus patients?
It's helped me a lot, actually. You know, I played football since I was 6 years old, and I've enjoyed the sport, from the workouts to the lifting in the weight room to the field, and even the camaraderie in the locker room. Discipline, focus, hard work, attention to detail, teamwork. I've had to be a part of a bigger team in this COVID-19 fight because as a neurosurgery resident, we do brain tumor, spine, peripheral nerve surgery. And now in COVID-19, the fight is more towards upper respiratory issues and trying to manage some of these very quickly complicating medical issues that we're not so used to as surgeons. So being a part of the bigger team, being a part of the bigger scope of practice here at Mass General Hospital, trying to do the best we can. I think also mitigating pressure has helped me. This is a very intense time with a lot of uncertainty between the patients and the patients' families and even our providers. And so football has taught me to stay calm, remain focused, rely on your fundamentals, and get the job done the best you can.
You know, it's just incredible going from the NFL to being a doctor and working in neurosurgery in particular. How did you make that transition and decide you wanted to go from the gridiron to the operating room?
So I knew I always wanted to be a neurosurgeon ever since I read Ben Carson's book, Gifted Hands, when I was in 5th grade, actually. As a pediatric neurosurgeon, Johns Hopkins, separated 2 twins from the occipital lobe and both lived. He was a legend and a hero for me. So I had him on my wall as my academic hero, and then I had Deion Sanders as my football hero. And so once and I got it out of my system, I said the next way I can make a contribution to this world is by using my mind and my intellect, and hopefully being another Ben Carson in the operating room. And I'm in my 3rd year now, actually going into pediatric neurosurgery as well. So everything has worked out well, and it's been a blessing to walk this journey and to have other people help me along the way, and to inspire young people who see my story and say I can be a student athlete and get to a level of success that I look forward to. So it's been a great time, and I'm very happy where I am, for sure.
It's an incredible story of your transition. You know, I do want to ask you, now that the NFL has just released its 2020 schedule, the NBA is looking to resume its season. Major League Baseball is strategizing on ways to start their season. Having played professional sports, being on the front line as well of this pandemic, do you believe there's a safe way to play contact sports during this time?
I don't. I think that it's rather ambitious to say we're going to start playing any sport right now. I think you have to be very careful, go low and go slow, and make sure that you're protecting not only the players, but also the staff, the coaches, the training team, equipment, and even the fans who are going to be in close proximity when they watch these sports. I think we can be comfortable being a little bit uncomfortable with delaying sports for a second, because we know sports are important, and we know that we've coalesced around sports in moments of tragedy and dire times with Hurricane Katrina, 9/11, and now this pandemic. We want to escape to this avenue, to this place where we can just enjoy some of our greatest athletes and our greatest moments. But for now, I think the premium needs to be placed on the health of these players and these athletes, go slow, see what the hospitalizations are happening, how much oxygen is being used in hospitals, are ICUs being transformed back into their normal purpose floors? Are we allowing visitors to come back into the hospital? Are elective surgical procedures opening up again? Are outpatient facilities opening up again? Once we see these trends go down, then I think we can resume those conversations about starting sports again.
Dr. Myron Rolle, a fascinating life story. I want to thank you very much, Dr. Rolle, for joining us.
Thank you very much for having me.